Fecal incontinence is a debilitating problem. It affects, unfortunately, about 2% of American women. What is fecal incontinence? Well, fecal incontinence is the inability to control your bowel movements. You can't get to the bathroom in time. It's not just that you have accidents. It can be a spectrum of diseases where you have a little bit of leakage in your underwear to where you have full bowel movements in your pants. This really is a majority female problem, and most of the time it's due to obstetric injury or childbirth. Fortunately, we have treatments these days. The initial treatment for fecal incontinence is changing the consistency of your bowel movements. We know that if we can add bulk to your bowel movements with fiber supplementation, that you will have a more formed bowel movement. A more formed bowel movement is easier to control. As I tell people, the muscles around your anus, the ones that control your bowel movements, are like the muscles in your hand. It's a lot easier to hold rocks in your hand than it is to hold water in your hand. So if we can make your bowel movements formed, we can help you. If you have a problem that's more than that, and that dietary management and fiber supplementation doesn't work, we have other things that we can do. And it's a whole spectrum of treatments that we have, anywhere from minimally invasive to fairly aggressive and invasive procedures. Fortunately, most of them work. And as we start on a spectrum, and most colorectal surgeons will start with minimally invasive procedures, such as injecting things or putting a pacemaker in. We'll further go along to adding a bigger operation where we actually reconstruct the muscles of your anus. And in the last stage, unfortunately, patients do end up with a colostomy. However, the thing is, we can improve your quality of life significantly. Colon and rectal surgeons are experts in the surgical and non-surgical treatment of diseases of the colon, rectum, and anus. We have completed advanced surgical training in the treatment of these diseases, as well as a full general surgical training. Board-certified colon and rectal surgeons complete residencies in general surgery and colon and rectal surgery and pass intensive examinations conducted by the American Board of Surgery and the American Board of Colon and Rectal Surgery. We are well versed in the treatment of both benign and malignant diseases of the colon, rectum, and anus, and are able to perform routine screening examinations and surgically treat conditions if indicated.